So it's healthcare reform unraveling. Here to make their case, Nate Silver, president of 538.com, and Philip Klein, Washington correspondent for the American Spectator. Nate, you start. What's going on here politically? Is it starting to erode?
I'd be a little bit nervous. I mean, I think some of this is predictable. You can talk a good game about healthcare, but when the realities come to passing a $1 trillion+ bill, it becomes more complicated. I think the lack of leadership we've seen from the White House, being hands-off, is a strategy that got them into trouble in the stimulus package, and I think they're going to have to take the lead here and be more upfront in selling this bill, not so much to the public, where it's still quite popular, but to constituencies in the Congress.
Philip, do you believe that there is a moderate middle position that Republicans can swallow that would involve some sort of public option?
No, I don't think that any sort of public option would be acceptable to Republicans. And I think the important thing that we learned this week is that details aren't President Obama's friend, because they undermine his rhetoric. He spoke at the AMA on Monday about how any health care would be deficit neutral. The same day the CBO rules that one draft of the plan will cost $1 trillion, and that's only a partial draft of the plan. It didn't even evaluate the whole plan. The real price tag is higher. And then they delivered an assessment, we found out yesterday, on the Finance Committee bill that it would be $1.6 trillion. And now Max Baucus says he's got to go back to the table to try to find $600 billion in savings. President Obama says that, well, if people like the health care they have, they can keep it. However, the health care bill that, the evaluation by the CBO was that millions of Americans would lose their employer-based health care under the proposal that came out of the Kennedy Committee. President Obama said that he touted this Safeway program, this health and wellness program that provides financial incentives for employees to live healthier. But the problem is the Democratic plan would outlaw that health care plan, because liberals don't believe it's fair to charge people more based on their health status. If you're overweight, or you smoke, or you have hypertension or higher cholesterol, Democrats and liberals don't believe it's fair to charge you more. And that's a provision of the Kennedy bill and most liberal health care bills.
Nate, let me bring you back in on this. I'm curious about a report that Tom Daschle was quoted as saying that the Obama administration would have to scrap the federal public option. His spokesperson later came out and said no. What he meant was they shouldn't let one issue derail what could be health care reform. Are some of the allies that were the usual suspects unsure here? Are we seeing more and more uncertainty there?
Well, one of the lines the Republicans are trying to push is the assumption that having a public option makes things more expensive. That might not actually be true. If you have more competition and more choice, there are a lot of models that say it would be a lot less expensive. The Kennedy plan that was scored poorly, frankly, by the CBO did not contain a public option. So I think there's some rhetorical ground here. The Obama administration might be losing a bit, but it's a complex issue. I mean, one problem Bill Clinton had in '93 is that he had a very convoluted, complicated plan that people didn't kind of get, and that's why you do have to have this joint effort to sell it to the Congress, but also to the public.
Nate Silver, president of 538.com, and Philip Klein, Washington correspondent for the American Spectator. Thank you both very much. We appreciate it.